The Subcommittee on Health will now come to order. Good morning, colleagues. Good morning, Mr. Secretary. Welcome. Due to COVID-19, today's hearing is being held remotely as well as in person. For members taking part remotely, microphones will be set on mute to eliminate background noise. Members will need to unmute their microphones when you wish to speak. Since members are participating from different locations at today's hearing, recognition of members for questions will be in the order of subcommittee seniority. Documents for the record should be sent to Megan Mullen at the email address we've provided to your staff, and all documents will be entered into the record at the conclusion of the hearing. Secretary Becerra has a hard stop at 1:15 p.m. today, so you will find that I will not be my usual generous self in terms of not lowering the gavel after 5 minutes is consumed. So we want to have enough time for every member to question. So the chair now recognizes herself for 5 minutes for an opening statement. Mr. Secretary, welcome to your first in-person hearing with our Health Subcommittee. What a difference a year makes. When you last testified at our subcommittee in May 2021, our hearings were virtual. The vaccine rollout was just beginning, and Congress had just passed the American Rescue Plan a few weeks before. Today, over 218 million Americans are fully vaccinated. COVID hospitalizations and ICU admissions are at the lowest they've been during the pandemic. Premiums under the Affordable Care Act are at an all-time low, and enrollment is at an all-time high. Nearly 6 million Americans have newly gained health insurance coverage over the past year, and American families have saved an average of $2,400 on their ACA health insurance premiums last year. President Biden's fiscal 2023 budget request continues these achievements by helping American families rebuild from the COVID-19 crisis healthier and safer than before. The budget invests $81.7 billion over 5 years in pandemic preparedness, including $40 billion for the development and manufacturing of vaccines, tests, and treatments, and $28 billion to rebuild the CDC and the public health workforce. These are incredible figures. Importantly, the budget provides $11 billion to address the overdose crisis, and every member of this subcommittee, Mr. Secretary, is engaged and care deeply about this issue. President Biden has called for a whole-of-government approach to save lives, get people the evidence-based care they need, and go after drug traffickers to stop overdose deaths. The president's budget outlines a strategy to use $20.8 billion to improve our nation's mental health, including increasing the availability of crisis care and achieving full parity. This is so important, and achieving full parity between physical and mental health care coverage. The budget continues to focus on addressing health disparities. It invests in quality maternal health care, especially for Black and Native women, while also increasing funding for the Title IX Family Planning Program. It takes the historic step of proposing $142 billion over the next decade in mandatory funding. This is a first for the Indian Health Services. Importantly, the president's request provides $5 billion in the Advanced Research Projects Agency for Health, ARPA-H, which holds the potential for transformational, advanced biomedical research to address diseases like Alzheimer's, diabetes, cancer, and ALS. As the House sponsor of the authorizing legislation for ARPA-H, I believe your decision to place ARPA-H within NIH let's just put it this way, I don't agree. That's in capital letters with exclamation points. There's still more to do. We still need a safe and effective vaccine for children under the age of 5. We need to make sure that vulnerable Americans' health insurance coverage is not disrupted when the public health emergency expires. We have to continue the health insurance subsidies from the American Rescue Plan. And we must finally allow Medicare to directly negotiate drug prices so that prescription drugs are affordable. So I look forward to working with you to develop a budget and policies to improve our nation's health and well-being. We thank you for being here with us today, Mr. Secretary.